I'd like to welcome you guys to Morning Mimosas. My name is Holly, aka Hanai the Goddess, and today I'm sitting with the lovely Miss Lisa Pearl. And today, guys, we're going to dive into something that it's going to be a little bit deep, y'all. Something that for some reason in the Black community we like to stray away from. And there's like a huge stigma behind it, which is mental health and generational curses. And but specifically with this one, we're going to talk about that from the standpoint of pregnancy and birth. So that's what Miss Lisa Pearl is here for. So we'd like to welcome you to Morning Mimosas. How are you doing today?
I am doing well. Thank you, Holly. And I'm really excited about this topic. It is definitely my calling. So go ahead and ask away what you like.
Perfect, Miss Pearl. I appreciate you coming on here and talking about this subject because it is something that we definitely need to talk about. And like I said, a lot of people like to stray away from it. There's a stigma behind it. Some people don't believe in it, but it's true, guys. So let's go ahead and start it off. So, Miss Pearl, can you tell everybody what you do?
Yes, I am a prenatal bonding doula. However, just recently I've decided to go ahead and start to do perinatal mental health therapy just because I see such the need to, like you said, address mental health issues because they definitely deeply impact birth outcomes. And so that's exactly what I do. I work on mental processes.
That is absolutely perfect. So, let's dive into it. So, can you speak on why there is such a big issue with mental health and, let's say, pregnancy for African American women?
Yeah, I would say that a lot of times when I hear people talk about mental health, they think that it's an issue like, oh, you're crazy if you seek any kind of mental health. So there's just been this stigma that's been in the community, also where we're not supposed to tell people our business, but at the same time, that business is destroying the family.
Hmm.
And
Yes.
um, and so that's the kind of thing like, being a Christian, I have to override some of the traditions. You see in the Bible, Jesus says you got to throw out your parents, your parents and your grandparents' traditions. And the fact is, if he says that what's done in the dark is going to come to the light, there's no hiding. There is no business that's going to be hidden. Matter of fact, it's going to express itself in so many different ways. And so for that healing to happen, it has to be brought to the light.
I absolutely and positively agree there. My big thing, I really wish there was a way for us to break the stigmas of that and to know that just because you have a mental health issue, that doesn't mean you're weak. You coming forward actually makes you stronger. I really wish we can, put that belief into people. It's 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 coming soon though. We're doing our part to make sure that that happens. So the next thing I also want to ask is when it comes to pregnancy and birth, when it comes to African American mothers. Everybody knows, not just African Americans, but just people in general. A lot of moms end up suffering with PPD, postpartum depression, right after birth, and they don't seek help, and for some reason their providers don't give them the resources like they give maybe other races the resources. Why do you think that that is?
Well, I would say in general, perinatal mental health is actually the new kid on the block. It's, and I think a lot of providers, just because of the hormonal shifts in pregnancy, I think that that's kind of what mental health issues have been chalked up to. And so they're never really explored. And so many providers, they're not trained to really recognize mental health issues. Because honestly, postpartum depression typically begins in pregnancy. It's not something that just suddenly comes upon a person right after they give birth. And
Mm.
so, like, it's not uncommon. Like, as I worked as a community doula for a while, and we did assessments, and it would be very interesting that a lot of them would say, oh, I just did this with my provider, but then their provider never provided any detail to say, hey, to really explore what that means. And so they're like, I didn't know that I was considered depressed. And I think for providers now, so much is happening that they have to handle. They don't have a whole lot of time to sit with patients. And so I just, yeah, it just kind of is swept under the rug type of thing. And so there's so many people, I think, like in general, they're suffering from it and no one's really catching it. And so that's why we're seeing more and more women now that are just kind of killing their children. People don't understand that postpartum depression, it can last up to 3 years even after birth.
Yes, that
So,
is true.
yeah.
That is so true. So I'm going to go ahead and speak from my experience since I have this lovely lady here. I have a 3-year-old and a 2-year-old, and I still suffer with postpartum depression. So it could last longer than the 12-month that they say that it is after birth. It can last longer than that. So if you feel like you have that, everyone, you guys need to come forward and try to get that help, because help is out there. You just gotta. Sometimes you have to look for it if someone's not going to help you.
Yeah.
So,
And I say, Holly, in what I call pregnancy, and it's, I don't want to take this on with somebody taking a term because I was in a training. They said this, but I've been saying this before I actually took the training, but I call it the great revealer. Pregnancy will reveal many of the issues that we have left unresolved, because there's so many emotions that are happening in that process of, the body changing and hormones, and it will resurrect things that like you have probably thought of in years, but what has happened is it's been swept under the rug, and now your body is saying you need to deal with this, because I call it a moment of beauty. It can be a moment where you address so many things and healing comes faster. I feel like there's this spiritual window opened up in pregnancy, because what is happening to you is directly impacting your baby.
Yeah.
But if those things are left unaddressed, what it does, it starts to build this chaotic nightmare. And this is what I say. If any woman that I see that's high risk, I basically know there's some past trauma. There's some trauma that's either past or it's happening right now.
Yeah.
It's not by chance that this is happening. There's something driving it.
So true. And I will go ahead and speak on that as well. So I lost my firstborn when I was 15, and she was 2 weeks old. And that trauma and losing her, it definitely portrayed itself in both my pregnancies, because I started thinking, oh, both of these babies are alive and healthy, and my daughter should be this age, and she's not. And so if you guys are having trauma too, I need you guys to also come forward, and please, like my whole thing about this, guys, is I want you guys to come forward and get help. Our community, for some reason, likes to put things on the back burner, or there's like I keep saying, a stigma, and I'm going to keep saying that word, a stigma behind it. But as we need the help so we can become our better selves. But you said something about a nightmare earlier and chaos. That actually brings me to my next question about generational curses.
Yeah,
I believe in those so deeply, and I'm trying to break generational curses with my own children now. So, what is a generational curse? If you want to explain to the viewers that don't know what that is.
Well, before I get into that, Holly, I want to say I'm so sorry to hear about the loss of your firstborn. And
thank you.
Yeah, and that's one of, like you said, that's one of the things that I hear very frequently. There is some kind of pregnancy tragedy, and it's very hard not to grieve those emotions, because a lot of times we're told, just move on, or it wasn't a real baby. You know what I mean? Like, because it didn't come, there's all kind of weird things that people say because they don't know what to say when those things happen. And so a lot of times moms have not went through the grieving process. And that's where, when I have clients that I come across and I hear that, we go through the process. I give them the space to be able to grieve. And many times there's so many things that turn around symptom wise. Like a lot of times that can be the difference between a high risk pregnancy and them going to a normal pregnancy.
Right.
Yeah. But let me go back to your question. I'm sorry, but I wanted to acknowledge that, and I didn't want that to go unacknowledged.
I just want to say thank you before I can let you continue. I just want to say thank you for that. Unfortunately, my daughter's passing was a murder. She was drowned.
Yeah, that's hard. That's hard.
Yeah, and it's unsolved, almost 15 years. So, it's hard. But yeah, so I was gonna start crying and stuff. I told me and her, we're sitting here having a conversation, y'all. So yeah.
You know what? Tears are okay. And there's, and like, I think that's another thing, like you said, in our community, like crying is considered weakness.
Right.
And it's not. We need to cry. I mean, it's a natural response that means you're a human being. That means that you have feelings. And some things, yeah, it gets better with time, but the pain is still there. Yeah. And it's okay to acknowledge that. And so I didn't mean but I just wanted to let you know I'm very comfortable with crying and tears, because that's where the healing comes. That's where the healing comes. So yeah.
I completely agree. It's coming though. My healing is coming for sure. But
yeah, it's a process. I mean, and I think that the more, like you said, if things were happening and you knew more information and you know who did it, that would bring a little bit more relief. It's just that the unknown that can be very difficult. Yeah. So, well, generational curses, Holly.
Yes.
Yes, I'm sorry. I'm getting back to what you said, but I wanted to stay with your feelings, because this is the whole point of why we're talking about wellness.
Yes.
So
yes, ma'am.
Generational curses are basically patterns of sin that we're more apt to dabble in because it's been traveling down our family line. It's a territory. Like the enemy has set up a territory in our bloodline. And for instance, I'm going to just be very transparent. One day I was praying and I was talking to the Lord, and he just said murder. And when he said that, I thought about it and I was like, wow. And it was like hidden in plain sight. So let me review this. On my paternal grandfather, which would be my great grandfather, he moved to Alabama out of nowhere. And the only thing that they knew about him was that they said he killed a white man. Okay. And so there was murder at that level, and come down a generation for my grandfather, he had a brother that ended up murdered. Wow. Two of my uncles were murdered. One was lynched and another one was just murdered. I think it was like a love triangle. Come down to my, it just kept flowing. So down to my generation, I had two male cousins that were murdered. And then one of my cousins that was murdered, his grandson was murdered. And wow, I thought to myself, and I had prayed about, curses. I was like, Lord, if there's anything that I'm missing, because that's one of my things I'm so dogmatic about. And this is why I'm so passionate about birth, because it's one of the things that have been impacted by generational curses.
Yes.
And, and sometimes we think, oh, this is just the way I am. And it's like, no, if you look around and you go back through the family, you'll see those patterns of tragedy that are just flowing. They're just coming down. And sometimes we think, oh, that's natural. No, that's not normal. Satan has a kingdom somewhere in your family bloodline. Somebody opened the door. And no fault of your own. It's
Right.
there. I just happen to be impacted because I'm prone to it because I'm a part of that bloodline.
Right.
And so, it always talks about, how it says, renew your mind so you'll know the acceptable will of the Lord. Being submitted to the Lord, he will show you those things because he doesn't want that to continue in your bloodline so that you can stand against them. I think it was in Nehemiah where it talked about how the people, they repented for the sins of their forefathers and they repented for their own sins that were connected to their forefathers' sins, right? Because we're kind of a victim of circumstance when it comes to that piece. But
Yes,
the blood
ma'am.
of Jesus can cleanse that out of your line. And you can say, no, Lord, no more. As for me and my household, we're going to choose to be obedient to you in this area. And we want you to change and put the blessing there. Did I
Amen.
answer your question?
Yes, you did. You answered it perfectly. So how do people determine generational curses? How do people look for the signs, and how do people start to break these generational curses?
Well, I say this, look at patterns of behaviors that are just considered normal that you think this is crazy, because generally that's where there's a sin setting that's continuing down the bloodline. Um, and as for like my mom's, a lot of times, I, like you said, I get into the nitty gritty of things because a lot of the parents I see, they're high risk and they're saying, hey, I really want a successful pregnancy. I don't want to feel this way. I'm having all these symptoms. And I'm like, I can only lead you, I can only guide you, but you have to be willing to do the work and look at things, even if it's scary, even if it's messy. Um, and I would say many times when I hear about people, they have miscarriages or there's infertility issues, I just kind of do a history check with them. And what I'll generally find out, there is a line, there's a history line of that happening and repeating over and over again. And what I always say with any generational curse, you have to be in agreement with the truth. No matter what statistics say, or what other people are saying. And so, there's instructions the Lord gave us for a reason. I think a lot of times we interpret as, oh, he's trying to stop our fun. I don't think we sit and meditate on why the Lord is telling us to do certain things.
Right.
Because you know what I mean? So
Yes, ma'am.
I'm trying to think where it's at in Psalms, but it was saying that those who love the Lord, how they meditate on his word to kind of get that further understanding. And you have to come from the premise that what the Lord is telling you is good and
Yes.
for your good. So once you accept that as good, now he has a place to give you understanding. We have this saying called seeing is believing, right?
Amen. Yep.
Yep. That's not how that works in the kingdom of God. We walk by faith and not by sight. So our understanding, God gives us more understanding when we say, Lord, I accept what you say is right. I may not understand why it's there, but I'm going to believe you're going to teach me. And when we do that, he starts to teach us what is right and why he's telling those things. Because it's nice to know why he's telling us those things. And so like with a lot of my families, I talk to them and there are things that have happened that shouldn't have happened.
Yeah.
Everyone keeps it a secret. And we just start to reveal it. If there's been tragedy, if there's been trauma, we talk about it, we process it. We're not going to let that sit there and traumatize the next generation. Because as you're pregnant and you're dealing with your trauma in your pregnancy, your baby is experiencing your trauma. You're teaching your baby what the world is like.
Mm-hmm.
And you're also
Yes.
transferring information. So they're going to naturally gravitate towards that trauma if we don't address that. And
For
so
sure.
that's what I'm talking about. I mean, um, people don't want to, talk about this. The church doesn't sometimes want to get messy with it, but like we have this thing where we talk about abortion. And yes, the Lord forgives us, but what about the trauma that's still being carried in that woman's body?
Right.
Yeah, she's forgiven, but it's just like this. A soldier that goes to war, yeah, he's going to war, and the Lord talks about going to war, but that still doesn't treat the PTSD, right? Them being forgiven doesn't
Right.
necessarily treat that. And
Right.
so we have to deal with those mental processes. And we just have a lot of things stored up. There's a lot of sexual abuse that happens and a lot of secrecy
Mm-hmm.
behind that. And it's just killing that woman on the inside. And so, of
Yes, it
course,
is.
with pregnancy, it's part of the sex spectrum. And
Yeah.
so it's, of course, it's going to resurrect all of that trauma around sexual abuse.
Yeah.
And so that's what I'm saying when I'm talking about, how to recognize this. Yeah, if you have that past trauma, if you see this pattern of behavior consistently happening time and time again in your family, that's probably a generational curse. And you need to come in line with that word and saying, Lord, I don't want this anymore. Teach me how to, change this. Who do I trust to get help to process this information so that it's not my nightmare anymore, but it's actually my testimony and I'm now an overcomer.
Yes, yes, yes. Man, you're just dropping gems and just telling the truth today, and that's what people need to hear. They need to hear the truth, good, bad, and the ugly. But I have one more question, and we're gonna get a little bit deeper with this one, and this is Black women dying in childbirth
Mhm.
and the lack of care. So the reason I bring this up is there was a story of a woman named Kira Johnson. She died 2 hours after having surgery after she had her son. And I've just noticed that more and more more and more Black women are passing away from childbirth because of either lack of care or their voices not being heard by a doctor. I
Yeah.
would like to know what your opinion on that is, as far as a Black woman, trying to speak up for herself, trying to get the care that she wants, and her voice not be heard by other doctors.
Yeah. I was, and I'll just say this, Holly, there is a lot of tragic things that happen in childbirth. If there's not a person that is well educated about the process to support moms.
Yes.
And part of this is this. I strongly suggest anybody, who's expecting to definitely take, a childbirth class, but also have somebody that's educated, whether it be a mom, a sister, or if you don't have that kind of person that's educated about the process, a doula. Because I think what is happening, birth is a very natural process. The problem is it's not treated like a natural process. It's treated
Right.
like a medical condition.
It is.
Mhm. And so a lot of moms go in and they're uneducated about the process. I think a lot of parents are, how would I say it, uncomfortable talking to their daughters on that level about their pregnancies, what to expect. And so, yeah, we're just not educated when we go into the birthing room. So we don't know what our rights are. COVID was definitely an eye opener for a lot of people. Like they didn't realize they had rights that they thought that they didn't have, and the hospital didn't tell them their rights. And so I tell every mom, definitely in the African American community, know what childbirth is like, know the information about it, know what your rights are, check out the hospitals that you're actually going to, because there's hospitals that are more baby friendly. They're more about
Yes.
natural processes, because now, and I'll just say this, the tragedy I see is that I just kind of cringe a lot of times when I hear people's birth stories, because there's just so many interventions, especially unnecessary cesareans that happen.
Yes, I definitely see that.
Yeah. And and I think the problem is, when I talk to clients, they'll go to their doctor and they're telling them, "Oh, we're going to do this," or, "Let's go ahead and do this induction." And it sounds like a fairy tale, but they're not telling them what it looks like in real time. So I break the information down to them and they're like, "Oh, I didn't know that." Well, that's what that's going to look like.
Right, right,
Um,
right.
and so a lot of people just don't realize a C-section, it is a surgery.
Yes,
And
it is.
and it's a serious surgery. Any surgery is serious because there's the chance of infection, them misplacing organs. I mean, they move your organs around. I don't know if you've seen one, but they move your organs around quite a bit to get that
Ooh-wee.
baby
No,
out.
I didn't know that.
Yes, it's something. It's something. And you know, you think about it, we're uniquely made. Just having maybe your intestines off just that little degree can impact you because we're very sensitive. You know what I mean? Like our insides and
Yeah.
all of that. So I mean, I that is my goal. Also doing some research on your doctor. There are some doctors that
Yes.
are just they have horrible reviews. You know, they are C-section happy, intervention happy. That's what they're known for. So, I mean, it really takes doing some homework. You know, you just can't go in trusting that your provider has your best interest at stake.
There it is. Boom.
Yeah.
There it is.
Well, Miss Lisa, we appreciate you coming on Morning Mimosas and giving us your wonderful insight. I have learned a lot from you today, and I completely appreciate you coming on here today. Do you have any last words for the Morning Mimosa viewers that are going to be seeing this or hearing this?
Yeah. I would say this, anybody, whether you're, you know, pregnant or not, living your best life is being spiritually, mentally, emotionally, and physically healthy, period. And
Yes.
we shouldn't let anything guilt us or turn us away from seeking health and wellness in those areas.
Yes.
Because whether we, you know, here's the thing, if we want to change the tide in terms of our generation, that's what we have to do. We have to do the hard things. And just like any healing process, there's going to be some pain, there's going to be some tears, but they're going to be well worth it when the next generation prospers. And that's what we want.
And you guys heard it here from Miss Lisa Pearl. Guys, I'm really, really excited for her and everything that she's going to be doing for our community, guys. You guys stay tuned. I will be posting all of where you guys can contact her in the description below. Once again, this is Morning Mimosas, where we put value in criminal justice, promoting healing and education in the Black community. You guys stay tuned. Bye-bye.